Hello, Diaz here, founder and owner of Greenwood Dental. Welcome back to another video. What's up, Doc? Diaz Confessions. So I was asked lately to make a video about dental insurances, which is basically the elephant in the room. It's a very awkward subject, very awkward topic, very uncomfortable conversation that we are constantly being engaged in and asked to explain and asked to research it and present it to patients. So I might end up doing this in 2 different videos because I don't want to overwhelm you guys with a lot of information. But these are facts and these are, this is reality, okay? So what we wanted to do is to really reach out to the public and all of you guys to help you understand where you stand as far as the dental insurances are concerned. So we were taught, or we are taught, not to allow dental insurances to dictate our diagnosis, of course, or dictate the treatment that's recommended. Basically, not to offer what insurance allows to treat, which is ethical, obviously, because a condition is a condition, regardless of whether you are allowed by the dental insurance to crown a tooth that's very compromised, it's gonna break and cause problem, or a tooth that's infected, again, compromised, it can cause high risk of, swollen face or more serious conditions. We are obligated ethically to introduce and recommend and advise the treatment that is gonna treat the condition regardless of the cost or the fee. But that's just our clinical obligation, and that's basically what we agreed on and what we promised ourselves and we promised the patient to do when we practice. So that's part of it. And the other part of it is basically you guys participating in an insurance plan to help you afford or help you get the best care possible. Okay, first of all, just for a background, dental insurances hasn't really changed much of your annual budget since the 1960s. So in the 1960s, a crown cost $50, where these days the fee for a crown about $1,200, $1,300, about $1,450. Okay, because of course our costs went up, the lab cost goes up, paying an assistant goes up and so forth. So our overhead goes up, but unfortunately the dental insurances don't really care. So they kept you guys at like the $1,500 a year, $2,000 maximum a year, regardless of how much work you need and regardless of, how much care you need, or regardless of what the prices, the market is. So what I did, I put a lot of notes because I just want to make sure that you guys receive the facts and get a better picture of the reality of where you stand when you commit to the dental insurances. Now, I just want to make it clear that we have no intention of dropping dental insurances. There has been a trend around us, especially in Massachusetts. Post-COVID, dental offices are dropping dental insurances. And that's been causing to, especially our Burlington office, is we're getting a lot of new patient phone calls that my dentist dropped the dental insurance, I can't afford it, are you guys in network, are you guys out of network? So I'm gonna go through that again. I might not have enough time to do it all today. I might have to do a second video, so stay tuned. If that's the case, look for it. All right. So we're going to start with differentiating dental insurance in network versus out of network. And that's one of the most common questions we get when you guys call us, okay? So this is a fact. 95% of the time in network versus out of network is the same coverage, as long as the out of network dentist or the dental office uses UCR. UCR stands for usual, customary, and reasonable fees. Okay, so that's very, very important to understand. Where they get you is like, don't go to a dentist that's out of network, it's going to cost you more. That's not true. What they mean, or they should say to you, okay, is, well, it's going to be the same, but depending on what that dentist actually fees are, what that dentist actually set up their fee schedule is. So as long as it's within usual, customary, and reasonable fees, which basically it's a process that every dental office should do, goes around the area, of course, and check what's the average fee that they're gonna charge, or they should be charging, depending on the overhead, depending on how much you're paying the team member to do the work, to help you to do the work, and so forth and so on, and then set that price. Now, if that dentist is charging above the usual, customary, and reasonable fees, which is, that's capitalism, obviously, so they can charge whatever they want, then that discrepancy becomes really high from out of network and within in-network. So that's very important to understand. Okay. So let's explain what UCR, usual and customary, reasonable fees are. There are fees that are determined by an insurance company by taking an average of fees from dentists in the particular area, town, or city. The insurance company then uses these fees to pay the out-of-network dentist, okay? So what happened is the fees that determined by the insurance company to tell it, oh, if you're gonna go out-of-network, it's gonna cost you that much, or it's gonna be an X amount of difference between what you get charged. They take the average fees from the dentist in the particular area, and the insurance company then uses the fees to pay the out-of-network dentist. Okay, so they play the game, they do their own research, and they say, okay, this is what the UCR in the area is, and then they're gonna say, okay, I'm gonna pay you that. All right, so that's what the insurance company does. So what I'm trying to tell you is, do not get nervous if we are out of network. As long as we are using the correct UCR for that area, for the town or the city, you should be okay. There's not going to be hundreds or thousands of dollars of upcharge or out of pocket for you. Okay. Now, that's the first point. The second point is, if out of network, dentist uses higher fees than UCR, then you will pay the difference. Okay, so it is very imperative from the dentist, their job is to make sure they're not above and beyond that UCR, because then it's gonna land on you. Okay, so then you're gonna have to pay the huge difference between out of network and in network. So all dentists should stay within the UCR. Okay, there might be a little bit, very, very, very small percentage that you're gonna pay out of pocket for the difference in network or out of network. But if there's a huge difference between in network and out network, it's not your insurance, it's because that dentist is charging way above the UCR in that area. Okay, so that's very, very important to understand. So that leads me into transparency. My confession today is, a lot of these offices make it so difficult for you to find the right match and to seek care. And unfortunately, they only think about themselves. Now, our brand, it's all about you. It's all about your experience, whether to set up these kind of fees so it will be very practical, very easy for you guys to shift seamlessly between out of network and network. Okay, so you guys can get the care that you need. And we do a lot of legwork, okay? Finding out, we do a lot of work trying to be reasonable, so it's a win-win situation for everybody. So I'm going to leave you with these 2 points, the difference between in-network, out-of-network, and hope that UCR concept is clear. But don't be nervous about that. Not in our office, not in our brand. Okay, with Greenwood Dental Partners, we make sure that it's fair, so everybody has the opportunity to get the experience that you're looking for as far as a Greenwood Dental partner is concerned. If you want that kind of experience that your mother or family member or friend had experienced, feel free to come in, and the discrepancy is not going to be there. So I'm out of time. I hope this helped. I promise I'm going to make another video to explain to you the frustration from our side. And we love you. Be safe and DS out. I'll catch you on the next video.